Hi, this is RxHelp, advice from a person on the other side of the pharmacy counter. Sorry that I've been a bit absent on YouTube. It's just I couldn't really think of much to talk about in a video. I have been blogging over at my blog, pharmacythoughts.wordpress.com. I tend to post there a little more often, but I finally did think of something to do a video about. So let's get right down into it. Today's topic is going to be based around a question that I receive pretty frequently at the pharmacy, and it's got a little bit of a complex answer to it. One of the most frequently asked questions at the pharmacy is, are brand and generic medications the same thing? And the short answer is yes and no. Yes and no. What do you mean yes and no? Isn't it black or white? Yes or no? Not yes and no? Well, no, it's kind of a gray area. So, are brand and generic the same thing? Yes. The yes portion is that, yes, they do have the same active ingredient. They have to pass a number of tests before they are ever released to the public. They're not just, willy-nilly, oh, here we go, here's a generic medication, da! They do have to pass a lot of tests to prove that they are similar in the way that it's broken down and absorbed throughout your body, and that it's going to be working in the same way. And it has to have the same active ingredient, so the same chemical compound, and it has to be that chemical compound, the percentage in that pill has to be within a certain percentage difference from the brand. So, say we're talking about brand Singular, which just went generic recently, within the past month. The generic manufacturers have to have the active ingredient of Singular. They have to have that chemical within 20% either way. So they can't have more than 20% of the active ingredient, but at the same time they cannot have less than 20% of the active ingredient that Singular does. Which 20% sounds like it's an awful lot, but for most medications it's not. That even if it is at the maximum of 20%, most people are not going to notice a difference in effectiveness either way. Like, I feel more side effects because there's more of it, or I'm not feeling the effects of it as much because there's not as much. 20% for most medications isn't a huge deal. Most people can switch from brand to generic without any problems. They do it all the time, and it's a lot cheaper, at least in the United States, where insurance companies kind of rule our lives. So for most people, when they ask me, are brand and generic the same thing, I usually recommend them switching over to the generic medication as soon as possible, and not to be afraid of it, because when I say most people, I'm talking like 85% or more can easily switch over with most maintenance medications without a problem. So, are brand and generic the same thing? No. The no portion of it. The difference in the brand and generic lies in the fillers in the rest of the tablet, and if they use a different color, the dye of that's in the tablet. So basically, the stuff that makes up the rest of the tablet, because the tablets you take, let's say Singular again, that whole tablet is not the chemical. There has to be other things that help hold the tablet together and disperse it throughout the tablet, because 5 or 10 milligrams is teeny tiny. You wouldn't even really be able to hold it in your fingers, never mind take it as a pill, so that you have to kind of fill it with other things that help it to maintain its shape and absorb correctly. So the generic manufacturers obviously use different fillers, and they usually have a different shape to them, so the pills look different. And like I said before, they use dyes to color it differently. So that's basically the big difference, is that they're using different fillers. So me personally, when do I recommend that people switch, and when do I recommend that people stay with one certain manufacturer, whether it be the brand name or a specific generic company that makes it? Okay, well, first things first, I always say to anybody who has any kind of celiac disease, gluten allergies, any kind of allergies like that, food dye allergies, like if they have a real true allergy to specific things you find in food and drug products, I tell them 100% of the time, stay with what you have. I wouldn't switch if I were you, just to be 100% safe, because I don't want you experiencing problems switching. People that have very sensitive allergies to things like that, them I definitely tell don't switch. People who are taking things like Coumadin, so like blood thinners, or seizure medications like Dilantin, things along those lines, I tell them to stay with whatever company it is that they're with, whether it be the brand name or it be a specific generic company, because those have a very narrow window within which they work the way that they're supposed to. And a little bit of screwing around with that can really mess up a person's levels of the drug in their system, and it can mess up how effective it is. If a person who is more sensitive than others can go from the brand name to the generic, and the slight percentage of difference that may be in one company versus the other, they may experience more side effects, or they may experience less efficacy, and they might have to have their level adjusted, get a whole new set of pills, worry about finding their sweet spot again. So it's just easier to have those people stay at the level, stay with the company that they're with, regardless of whether it's brand or generic. So that's another example. But those are really the two biggest examples. The only other time that I tell people, you might want to stay with the company that you're with, is if they seem to have a lot of problems, like have more side effects, because people do have more side effects with some generic medications versus others. It is possible that you may get bad side effects from one company when your friends and family are perfectly fine with it. So everybody's a little different, but those people that seem to have issues like that, I also tell them to stick with what works for them. So that's about it for today. It's a little complex, but basically brand and generic are the same thing in the fact that they have the same active ingredient, and they have to prove that they are absorbed and digested and metabolized through the body in the same way before they are allowed out on the market. But generics do have different fillers from brand. They have different colors a lot of the time, and they have different shapes. So always speak with your doctor or your pharmacist if you are hesitant about switching. We don't mind. That's what we're all here for. We're here to make healthcare work for you, and we're willing to go above and beyond to help you get what you need and live a healthier life. So that's it for today. Sorry it was a little bit of a ramble, and I hope that you guys have a great day, and I'll see you guys in the next video. Bye!